Hello everyone. We are students of Nursing Leadership and Management in Seneca College. And today we are going to present part 2 of Capstone project on medication errors related to insulin.
ISMP Canada Safety Bulletin 2007 released a recent cluster of voluntary submitted medication incident reports in which the use of insulin led to the harm to the many patients. The 10 drug accounted for 43% of all the harmful medication incident reported to ISMP Canada. Of course, insulin was the second leading cause to the harm. The topic of medication error related to the insulin was chosen because the insulin constantly remarked among the most frequently reported medication in the harm of the incidents. ISMP Canada released a report which revealed the data taken from January 2015 to January 2020 showed that 7.8% of the insulin-related medication error were recorded in the hospital. As a nurse leader addressing the medication incident, particularly related to the insulin, several solutions and quality improvement can be implemented. First of all, involve the patient and family members, secure a leadership and the staff commitment to the medication reconciliation as a priority. Involve a multidisciplinary team. Provide a documentation tool, whether electronic or the paper-based. The study on the sliding scale insulin protocol implementation revealed that the protocol reduced the complexity and the variability of the SSI orders, which helped to reduce the prescribing errors and the hyperglycemic episodes. The study focused on addressing the high frequency of the medication error and adverse. It was an observational study comparing outcomes before and after the implementation of the standardized SSI2 protocol with the pre-printed physician form orders. It was found that within a year, prescribing error dropped significantly from 10.3 to 1.2.
Reducing insulin-related errors through a standardized sliding scale insulin protocol. Measuring outcomes. There are two types of measuring outcomes, qualitative data and quantitative data. Quantitative data measuring errors, rates and occurrence of hypo or hyperglycemic events pre and post protocol will give objective data to reflect improvements. For example, expecting a reduction in incidence of hyperglycemia by 50% over a certain period gives measurable endpoints. Leadership can evaluate for improvements to have occurred according to Donahue et al. 2006. Qualitative data, staff and patient feedback would give an overview of the efficacy of the protocol in accomplishing its work and whether it is usable. Surveys show whether the protocol is workable, enhances care quality, and if any changes must be made to it. ISMP Canada 2024. Barriers and solutions. Barriers like resistance by staff, insulin is complex. In resistance by staff, the most common reasons given by the staff is additional workload, change of routine, and even just an excuse. Strategies include clear communication, training, and creating an environment for patient safety according to Donahue et al. 2006. Insulin is complex. Dosages can differ widely between patients and adding double check systems and barcoding technology makes the process more reliable by minimizing human errors. ISMP Canada 2024. Stakeholder impact. Staff, leadership and patients and families. Staff, a clear protocol produces stress and better equipped staff to handle insulin confidentiality. Leadership, it is important for leaders to monitor the improvement and sustain the culture of safety. Patients and families, continuous insulin administration minimizes risks and promotes improved outcomes in patients, therefore helping to build confidence among family members about the care provided.
Plan to ensure sustainability of insulin error includes foster a culture of safety of all medication incidents including near misses through systems like Canadian Medication Incident Reporting and Prevention System. Data analysis to track insulin related errors. Then next comes with the standardized protocols, which includes develop and enforce standardized protocols such as sliding scale insulin model. Double checking procedure requires two healthcare professionals to verify insulin doses and administration according to ISMP Canada 2003. ISMP Canada formed an expert panel to select two key insulin use interventions and create supporting guidelines and campaigns. Next comes with the technology integration, which includes the use of electronic health records to track insulin use and blood glucose levels in real time and implement advanced technologies. Then comes the patient education in order to prevent and reduce the insulin errors. Then comes monitoring and feedback, which includes glycemic control monitoring and ongoing feedback. Leadership style. A transformational leadership approach is crucial for fostering a culture of safety and driving ongoing improvements in insulin administration practices. Transformational nurse leaders will inspire and motivate staff to prioritize patient safety while adopting new protocols. Lead by example, showing a strong commitment to reduce insulin-related errors and enhancing patient outcomes.
The Newman Systems Model, given by Betty Newman, provides an effective framework for this initiative, focusing on systemic interventions which aligns the goal of enhancing insulin safety. So first we will talk about primary preventions. Nurses can prevent these errors by educating both patients and staff on proper insulin administration, improving communication during patient handoffs. Then comes secondary prevention, which include real-time monitoring of blood glucose levels and insulin doses that allows for early detection of issues, enabling timely interventions to prevent complications such as hypoglycemia and hyperglycemia. Then lastly, we have tertiary preventions, which includes ongoing evaluation and adjustment of protocols, resources needed to sustain this change. First of all, we have financial resources, which include technology investments, that funding will be needed for barcoding systems, automated insulin delivery devices, and we have staffing, that resources should be allocated for hiring additional personnel or designated specific roles. And in human resources, we have nurses, pharmacists, physicians. By consistently leveraging these resources, the goal of reducing the medication errors related to insulin safety can be reduced.